You might be wondering, is it really okay to ejaculate every day? As a urologist, I hear this question often, especially from men who are trying to take better care of their health as they age. If you're over 50, it's natural to be curious, or even concerned, about how daily ejaculation could affect your prostate, testosterone, or overall well-being. Today, I'm going to give you the real, science-backed answer. Without shame, without judgment. Just facts, from a doctor who truly cares about your health and your quality of life. Let's start with a common concern many older men have. Is daily ejaculation harmful or helpful for my prostate? The good news is research suggests that regular ejaculation may actually support prostate health, especially as you age. The prostate is a small gland that plays a big role in your reproductive system. It produces a major portion of the fluid in semen. Over time, especially after the age of 50, the prostate can become enlarged or inflamed, leading to conditions like benign prostatic hyperplasia (BPH) or even increasing the risk of prostate cancer. That's where ejaculation comes in. Studies, including long-term research from Harvard, have found that men who ejaculate more frequently, around 21 times per month, tend to have a lower risk of developing prostate cancer compared to those who do so less often. While 21 times a month might sound like a lot, the key takeaway is this: regular ejaculation appears to help flush out the prostate, reducing the buildup of potentially harmful substances in the gland. Think of it like cleaning your pipes. If fluids sit still for too long, they may stagnate. But regular flow keeps things moving and reduces the chances of problems forming. Ejaculation can work in a similar way for your prostate. It keeps the system active and less prone to inflammation or blockage. It's also worth noting that regular sexual activity or masturbation can improve blood circulation to the pelvic area, which may help the prostate function more smoothly. This can contribute to reduced urinary symptoms and better comfort over time. That said, it's important to listen to your body. If daily ejaculation feels physically or emotionally draining, it's okay to reduce the frequency. The goal is not to reach a number, but to find a rhythm that supports both your comfort and your health. Also, if you have any prostate issues already, like chronic prostatitis or BPH, it's wise to discuss your sexual habits with your urologist. Every man's body is different, and personalized advice is always best. To sum it up, ejaculating daily is not harmful to your prostate. In fact, it may be beneficial. As long as it feels right for you and you're not forcing anything, daily ejaculation can be a healthy part of your routine. Remember, taking care of your prostate doesn't have to be complicated. A little consistency, a bit of awareness, and open conversations with your doctor can go a long way in keeping you well. One of the most common concerns men have, especially after age 50, is how daily ejaculation affects testosterone levels. Testosterone plays a key role in energy, mood, muscle strength, and sexual function. So it's completely natural to wonder, does ejaculating every day lower my testosterone? The simple answer is no, not significantly. Daily ejaculation does not cause long-term drops in testosterone for most healthy men. Let's look at what actually happens in the body. When you ejaculate, there may be a very brief, short-term dip in testosterone right after. But this drop is temporary, kind of like taking a short break after a workout. Within a few hours, your hormone levels naturally bounce back. In fact, several studies have shown that regular ejaculation doesn't deplete your testosterone reserves. Your body keeps producing this hormone in a steady cycle, regulated by your brain and tests. So even if you ejaculate every day, your body adjusts and maintains balance. Some men believe that avoiding ejaculation for long periods, what some call retention, can build up testosterone, but scientifically, there's very little evidence to support that idea. In fact, prolonged abstinence might lead to increased frustration, mood changes, or sleep issues, especially if sexual urges are strong and unmet. Now, if you feel more tired or drained after frequent ejaculation, it's likely not because of low testosterone. It might be due to hydration, sleep, age-related recovery time, or emotional factors. These are normal and can be managed with rest, good nutrition, and stress reduction. Also, keep in mind that testosterone levels naturally decline with age, usually starting in the late 40s or early 50s. This is called andropause, and it's a normal part of aging. Ejaculation doesn't accelerate that process. It's more about genetics, lifestyle, and overall health. If you're concerned about your testosterone, if you're noticing fatigue, low mood, reduced sex drive, or difficulty with erections. It's always a good idea to get your levels checked by your doctor. A simple blood test can provide clear answers. So to reassure you, ejaculating every day will not cause harmful drops in testosterone. Your body is built to handle this level of activity, as long as you're feeling good and not overexerting yourself. And if your energy seems lower, it may be related to other aging-related changes, not the ejaculation itself. In short, don't worry about testosterone loss if daily ejaculation feels natural and comfortable for you. Stay in tune with your body, be kind to yourself, and don't hesitate to seek support if something feels off. As men grow older, many begin to notice changes in their sexual function. This is completely normal, and it's nothing to be embarrassed about. But if you're ejaculating every day, you might wonder, will this affect my sexual performance, stamina, or sensitivity over time? Let's talk about what really happens and what doesn't. First, it's important to know that sexual function naturally evolves with age. You may notice it takes longer to become aroused. Erections might not be as firm, or recovery time between erections, known as the refractory period, may increase. These changes are often due to reduced blood-shifting hormone levels and age-related muscle changes, not necessarily how often you ejaculate. Now, when it comes to daily ejaculation, the effect on sexual function can vary from person to person. For many men, it's perfectly fine and doesn't interfere with their ability to enjoy sex or maintain performance. In fact, regular ejaculation can help maintain erectile health by improving blood circulation in the pelvic area and keeping the sexual response system active. However, for some men, especially those over 60, ejaculating daily might lead to temporary fatigue, reduced interest in sex, or a feeling of being overstimulated. This isn't harmful, but it may indicate that your body needs more time to rest and recover. If that happens, it's okay to adjust your frequency. Remember, sexual health isn't a race. It's about balance, enjoyment, and well-being. There's also a psychological component. If ejaculation becomes a routine or obligation, rather than a source of pleasure, it can reduce satisfaction over time. Being mindful of this can help you maintain a healthy, positive relationship with your sexuality. One thing to watch for is if you notice a decrease in sensitivity, weaker erections, or less pleasure over time. If these symptoms persist, it's not likely due to ejaculation frequency alone. It could be related to age, medications, stress, or underlying health issues like diabetes or hypertension. These are best addressed with your doctor, who can help tailor a plan that supports your sexual function and overall health. Here's the bottom line: daily ejaculation won't damage your sexual function. It may actually help keep things working well, if it feels good and you're not forcing it. If you notice changes, that's normal with age. But help is available. Sexual wellness is a lifelong journey, and it's okay to adjust your habits as your body changes. Whether you ejaculate daily, a few times a week, or less often, what matters most is how you feel physically and emotionally. If you're ever unsure, talk to a urologist. We're here to help you understand what's normal, what's not, and how to stay comfortable and confident in this stage of life. Let's begin with a simple truth. Sexual activity is not just physical. It's deeply connected to how we feel inside. Daily ejaculation, whether through sex or masturbation, can release a wave of feel-good chemicals in your brain. These include dopamine, oxytocin, and endorphins. These natural brain chemicals help promote feelings of pleasure, connection, and relaxation. They're often referred to as your body's own mood boosters. For many men, especially those who are retired, living alone, or managing chronic health conditions, regular ejaculation can be a source of comfort, stress relief, and emotional grounding. It creates a moment of intimacy, even if you're by yourself, and that emotional closeness with your body is something that should be respected, not shamed. In fact, studies have shown that regular sexual activity is associated with reduced levels of anxiety and depression in older adults. It may also improve sleep quality, because the release of oxytocin and prolactin after ejaculation promotes calmness and drowsiness. So if you find it easier to sleep after ejaculating, that's not just coincidence. It's biology working in your favor. There's also the benefit of routine and familiarity. In later life, when many things are changing, health, social roles, relationships, having a simple, personal habit like daily ejaculation can help provide a sense of normalcy and control over your body and your needs. Of course, balance is important. If daily ejaculation becomes compulsive, something you feel you must do to cope with stress or escape emotions, it might be a sign to reflect or seek guidance. The goal is for the experience to be comforting, not consuming. It's also worth noting that sexual expression doesn't always require a partner. Self-pleasure can be a healthy and normal part of your routine. There's no age limit on enjoying your body, and there's no shame in taking care of your emotional health through safe and private means. Here's what I want you to remember. Daily ejaculation can bring peace, improve mood, and even help you sleep. It's not just about sex. It's about connection, comfort, and emotional wellness. If it brings you joy, calm, or clarity, it's likely doing something good for your mental health. As a urologist, I encourage my patients to view their sexual health as a full picture. Physical, emotional, and mental. You deserve to feel good in all areas of your life, no matter your age. Now let's talk about something important, especially as we get older: how daily ejaculation may affect your energy levels and physical comfort. Some men report feeling tired, drained, or even slightly sore after frequent sexual activity. So, is there a real risk of overdoing it? The honest answer is yes. Daily ejaculation can lead to mild physical fatigue in some men, especially those over the age of 50. But let's explore why and what you can do to manage it. Ejaculation, while natural and healthy, is a physical act. It involves muscular contractions, increased heart rate, and a brief spike in blood pressure, even if you're not engaging in full sexual intercourse. Say you're masturbating, it still requires energy and focus. For younger men, recovery from this is usually quick. But as we age, the body may take longer to bounce back. For some, ejaculating every day might result the mild pelvic or lower back stress chitta feeling of tiredness or sleepiness, afterwards interest or ability to become aroused the next day, a sense of being worn out. Particularly if you're not getting enough rest or nutrition, these effects aren't dangerous, but they are signals from your body asking for rest and recovery. It's also important to consider any underlying health issues. Men with conditions like high blood pressure, diabetes, heart problems, or chronic fatigue may feel the effects of daily ejaculation more strongly. If you're taking medications that affect blood flow or energy levels, your body might need even more time to recover. What's the solution? Listen to your body. If daily ejaculation feels energizing and you feel good afterward, there's likely no problem. But if you notice it's leaving you tired or less interested in sex over time, it may be time to ease up a bit. Try every other day, or adjust based on how you feel physically and emotionally. Remember, your sexual health is not defined by how often you ejaculate. It's defined by how balanced and satisfying your experience is. Quality is more important than quantity. Also, support your body by staying hydrated, eating nourishing foods, and getting regular exercise and sleep. These basics go a long way in maintaining healthy sexual function and stamina. In short, daily ejaculation may cause mild fatigue or physical strain in some older men. But it's not dangerous. But it's important to recognize your body's limits. Adjust your habits to what feels right, and don't compare yourself to anyone else. As your health consultant, I want to reassure you there is no perfect number when it comes to ejaculation frequency. What matters is that it works for you, supports your well-being, and fits comfortably into your lifestyle.
What above your previous notions out? Because you're with key point 6 on daily ejaculation and long-term wellness. When it comes to long-term health,
many men want to know, is ejaculating every day helping me, or could it be doing harm in the long run? It's a fair and important question, especially if you're over 50 and thinking more about how your daily habits affect your overall well-being. The encouraging news is this: daily ejaculation, for most healthy men, is not harmful to long-term wellness. In fact, it may offer some positive health benefits, both physically and emotionally. Let's start with the physical side. As mentioned earlier, research suggests that regular ejaculation may reduce the risk of prostate cancer. It helps keep the reproductive system active and reduces congestion in the prostate gland. Over time, this can support a healthier urinary system and reduce discomfort or inflammation. Additionally, daily ejaculation may improve circulation to the pelvic area, which is important for maintaining sexual function and reducing the risk of erectile dysfunction. Just like regular exercise keeps your heart and muscles strong, Regular sexual activity keeps your reproductive system working well. On the emotional side, consistent sexual release can help regulate mood, reduce anxiety, and improve sleep. All essential factors in aging well. Seniors who maintain healthy sexual expression often report higher levels of life satisfaction, self-esteem, and relationship quality, even if the activity is luck. But it's equally important to understand that balance is key. Not every man needs or wants to ejaculate daily. And that's perfectly okay. If you push yourself to do it out of pressure or habit rather than desire, it may become tiring or even reduce enjoyment over time. Some men may also experience mild fatigue or reduced sexual sensitivity if there isn't enough time for the body to recover. That's why I often recommend using daily ejaculation as a guideline, not a goal. Your body knows what it needs. You might feel great doing it daily for a while, then naturally slow down. And that's healthy too. Also, keep in mind that sexual health is just one piece of your overall wellness puzzle. Staying active, eating nutritious food, managing stress, sleeping well, and having meaningful social connections all play a role in long-term health. Ejaculation isn't a replacement for these, but it can be a positive part of your self-care routine. In summary, daily ejaculation is not harmful to your long-term health if it feels right for you. It may benefit your prostate, improve mood, and support healthy sexual function. The key is to be in tune with your body and focus on what truly supports your well-being. As your trusted urologist, I want you to feel empowered to take care of your health in ways that feel natural, balanced, and respectful of your body's needs. Aging doesn't mean giving up on pleasure or intimacy. It just means listening more carefully to what your body tells you. Your health journey matters, and so does having honest, respectful conversations about it. If you found this video helpful, please subscribe for more clear, expert-backed guidance on men's health. And if you have questions, drop them in the comments. I personally read them, and I'm here to help. Take care of yourself. You deserve it.